Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
One.
Morning. Good morning.
Morning.
Good morning.
This is an interesting article that confirmed what was previously identified, that loneliness has become epidemic and is tied to many things, including increased stroke risk. It's an article that just helps us realize the importance of one another. Being lonely and being alone, something that generally can be dealt with, although you have to have a willingness to want to meet people. Some people are loners, and as such, they lose out. And so this article kind of impresses once again, as if we didn't know it already, that dealing with others and working with other people is good. And being alone and lonely isn't. And that loneliness is ever increasing. I think that last year they pointed out that it was reaching epidemic proportions. So the social interactions, more than just good for anxiety purposes, but are good for good health purposes. You do many things to overcome loneliness, including physical exercise and all that stuff. But that, together with social interactions, is much better than that without it. Any comments about that?
Yes, sir. Good morning, everyone. I'm Peter here. My comment about this article is that it's a double-edged sword, because if loneliness increases the chance of stroke, and you need someone to be around you when you do have a stroke so that they can call 911 or the ambulance or whatever, that's a bad time to be lonely. That's my point.
That's true. Any other comments?
Yeah, I have a comment. The idea of what loneliness is it's not exactly equal to being alone, because you can be around a lot of people and be lonely just because you are afraid of crowds, afraid of contact. You have fear of interaction. So it's not equal. Being alone and being lonely uh, are not the same. But the loneliness, to me, the loneliness feeling is to me what they're talking about. Even being alone can make you lonely, but you can be around people and still be alone. It still be lonely.
Any other comments?
Yes, it's called avoidant personality disorder. When you don't like to be around people, avoidant personality disorder.
Okay, let's go to the next article then. It's interesting that we now are able to, by way of brain imaging, identify different types of depression and anxiety. It's interesting that they're doing so many brain wave testing that no secrets anymore. And they can tell what you're thinking about, and what you're not thinking about. And this is brain imaging is something that is becoming more and more being done more and more because we learn so much more about mental illness, and especially depression, which is something that the pain of depression is not understood by people who are not depressed. And that pain that often will often result in people committing suicide is something that the more we understand, the better we are able to try to deal with it. You know, every day we see somebody else who's committing suicide and wondering why, and not understanding the pain and agony of depression. And so the good side of it is that with a lot of this brain imaging, you may be able to identify the areas in the brain that are associated with it. And it's clear that certain medications will help with depression. It's also clear that the side effects of some of these medications forces some of those people not to want to continue to take medications. But so we're making progress, and but we're still not yet able to really understand the pain and agony of depression that people go through. I listened to a judge once talk about depression and how it makes you feel so negative about yourself that you don't want to go on. That pain and agony is something that people who are not depressed don't understand. Any comments about any of you know people who have been so depressed that they become suicidal?
Yeah.
And
Janice, did you want to say something?
no, I'm not aware of anyone that has become suicidal.
Yeah, I've had an opportunity to meet a number of people who are very depressed.
Yeah.
And when you have family members who are depressed, it can be contagious.
Mm.
You have some families that are noteworthy because so many people in their families commit suicide. And they actually have depression almost like as a genetic entity in their families.
I had a question, Dr. Callender. What do they mean that depression is heterogeneous?
Well, I mean, it's everywhere. You find it everywhere. In the all the young, the rich, the poor, the religious, the unreligious. So there's no respecter of persons. So that's one of the meanings of heterogeneous. It's find it anywhere, everywhere, and it's true. There's so many people. 30% of patients are resistant to treatment, and that's some of it is because of the side effects of the medication, but some of it is because they don't want to take it. They still want to take the medicine. So it's something that seems to be ever increasing.
What are some of the side effects that they are trying to avoid?
Sometimes the side effects are gaining weight, swelling, and sometimes the side effects of being jittery. Those are just some of the side effects.
Dr. Callender, speaking about the medicine for depression that psychologists prescribe, um, as you said earlier, they help, and so it is one of the side effects that you get so dependent on the medicine that when you don't take it, it causes a new problem. Have you heard about that?
Well, the problem it causes is that they go back into the depressed state that they were before, and they become suicidal. And many people then, that's when they commit suicide. Stop taking the medications. We had many people who we think are happy, but they're not, and they have manic depression, the ups and downs. They call them, yeah. And so when they have the manic phase, they're happy. You get the depressed phase, they're suicidal. And so when they take the medications, they aren't depressed. When they stop taking the medication, depression supersedes, and that pain and agony of depression gets them to the point where they feel useless and worthwhile. I mean, worthless. The judge was talking about that. When you get depressed, it's all from inside, all from inside, and it's tough to deal with unless you get help, whether it's psychological or medication. So I think that's an area that is so painful to see that so many people, because they're manic depressive, you see the happy side of them, but you don't see the sad side. So it's just I guess the moral of the story is that hopefully this brain imaging will help us to diagnose more often those people who actually have manic depression and be able to help them through the depressed side, because that becomes as painful as any agonizing pain that you have, except it's internal. Nobody else feels it but you.
I had another thought. Excuse me, Doc. Um, Brain imaging. How does that happen with the average person who has depression? Isn't brain imaging a very expensive deal?
No, I just put electrodes around your head, and they transmit your brain waves. So it's not expensive. It's just that it's not done that much. And we have started using that to identify uh, different types of mental ailments, and also how to identify what you're thinking about, what your emotions are, where they come from in the brain. But it doesn't hurt. It's not nothing like that. It's not expensive, but it's not something that we routinely do. But it's something we're going to be doing more and more as we become comfortable with brain imaging. So that's something that you wouldn't often see, but that's in the past. But in the future, it's likely to become more helpful in terms of making diagnosis of mental illnesses.
So would the psychiatrist do that as opposed to a psychologist?
Uh, Probably really wouldn't matter, a psychologist or a psychiatrist. It's somebody who's interested in why people do what they do, and they want to see, for example, in our psychology department, I think they're doing more of that brain imaging than, and I don't know about the psychiatry department. I know psychologists are very much interested in what your emotions are. And so brain imaging is something that may be more likely to be found in psychologists because they're really concerned about why you do what you do and how we can look into your brain and see what's going on.
All right, thank you.
Okay, let's go to the next one. It's interesting that not too many people on this call are associated with people who are depressed. So it's this is study about how laser hair removal is litigated, which means that you get lawsuits. And so, because we're doing more laser hair removal, this then becomes a dermatological nightmare for some. I don't know people who are interested in having their hair removed. I know more people who want to have hair than I do people who want to have hair removed. But plastic surgeons probably deal with this more than anybody else because sometimes people have hair where they don't want to have hair, especially around the, especially for women, around the face. And there's certain medications that cause a side effect of growing hair in places where where there isn't hair. And in these situations, hair removal becomes an issue, and this is where the litigation is involved. You get lawsuits because of the burns or other things that occur, hyperpigmentation or scarring. So it's not something that many of us see, but it's just something that when you get the side effects of some of these medications and you have hair growing in places where it used not to grow. And one of the most powerful antihypertensive medications associated with hair growing, so much so that they use it for people who are bald so that they would grow hair in their heads. But anyway, it's something that would be interesting to share. Getting appointments to see dermatologists is not always that easy to do, but it's something that, as we age, we get all kinds of bumps and lumps that occur because of aging. So you wind up going to a dermatologist for that as well. Any comments about this?
I have a question, Dr. Callender. How come it's so hard to get a dermatologist appointment?
It's so popular. So many people need to see dermatologists. I guess that's why they're not a whole lot of dermatologists. But I think I know when I've wanted somebody to see a dermatologist, I would just get to some of those not so popular dermatologists, like Dr. Callender is probably the busiest dermatologist in the area. Getting an appointment with her, if somebody was bragging to me the other day because they got an appointment to see her in October. Well, there are a lot of other dermatologists around who you can get to see that you don't have to wait till October. But that is a fact, though, that dermatology appointments are hard to get if you want a specific dermatologist. If you don't want a particular dermatologist, there are enough dermatologists around.
I was thinking, Dr. Callender, that because the skin is the largest organ in the body, right?
Yes.
There's a lot more lot more chance to have problems. But it seems weird that I mean, who gets sued? Does the doctor get sued, or does
Yeah,
the
yeah. No, they're talking about people who have hair removed by lasers, and the laser can burn the skin or cause hyperpigmentation and those kinds of things. And so, yeah, the plastic surgeon or the dermatologist who does the hair removal would be sued.
are there other ways to remove the hair other than lasers?
Well, yeah, but you use a razor. Men use razors every day to take hair, and that's the simplest way to do it. And we do it every day. But sometimes it's in places that not as easy to remove. Let's go to the next one. As if we needed more reason not to have a lot of salt. It's also showing that high sodium intake is linked to greater risk for eczema, which is a skin condition, which is very common in the teenagers, but is also common in general. And high sodium intake increases the risk for eczema, which is a skin condition that many have, but especially the people going through the teenagers and that hormonal changes that increase eczema, which really have scaly lesions of the skin, which may or may not respond to dermatological treatments, steroids, and other. But salt is problematic for many reasons, and this now becomes an additional reason not to eat a lot of salt. I guess we already have enough reason not to eat a lot of salt. But
Uh,
the seasoning of the food is. Betty, you got a comment?
yes, I just looked at that eczema. When my first child was born, I'm assuming he was born with eczema because he had a problem with drinking regular milk. I had to put him on special milk. And so my question, I guess, really is to Dr. Perez. I thought she was on here, but I see she isn't. About whether you can transfer your salt intake to your child, because he wouldn't have had any sodium, at birth. But I used to eat a lot of potato chips. So I'm wondering whether I was the culprit, whether I gave him the eczema.
I don't have enough knowledge to answer that question.
Yeah.
That's a tough one.
Yeah.
No.
But he was born with it, so.
Yeah, which is unusual. Yeah. Sorry, I can't give you an answer for that one.
Yeah, I was thinking Dr. Perez was on here, but I see she isn't.
Yeah, I just want to make a comment about eczema because I had a little misunderstanding myself. Eczema isn't the same as acne. Acne produces pus, but eczema doesn't. Eczema is usually characterized by scaly, reddish, typically itchy patches of skin.
Exactly. Yeah.
Okay, let's go to the next one. Now, this is an interesting article that tells us the gravity of the situation we're in with microplastics, and the fact that they found this in 4 out of 5 of the penises they looked for. And the reason they didn't find it in others, they didn't look for it, because who would have thought that the microplastics are in everything and everywhere. So this is a frightening reminder that the problem with microplastics is beyond comprehension. I guess that's what this article says to me, is that the issue that we have with microplastics is even worse than we thought it was before, and we thought it was problematic before, but with this article, it tells us that the end of that situation is not in sight. Any other comments about this shocking finding?
My question is the motivation. Why would someone think to look at penis tissue? That's number one. Number two, how do you get these images of penis tissue? You have to do a biopsy?
Yeah, they don't have to be. It can be done after life, after death, or it can be done if somebody has a penile implant or some other thing. But yeah, it requires a biopsy. Yeah. Mm-hmm. These are people who had erectile dysfunction, so they were doing things with the penis to try to get them to have an erection. And so one of the things that occurs is they have poor circulation in the penis. And so that's a situation in which they would get a biopsy. Would I have thought of that? No, I wouldn't have, but these urologists had read enough about microplastics to wonder about the expansion of this, and so they did the biopsies. That's amazing, shocking.
So have they made a connection between the microplastics and the ED or other?
No, I don't think it's related. I think what it demonstrates is that it's everywhere, and that all we have to do is look for it. I think it has nothing to do with necessarily with ED, but it certainly manifests itself that the microplastics is everywhere and in everything. But I don't think that they've even thought to relate it to the ED. They just recognize that it is everywhere. And we talk about using stainless steel and glass containers and all that stuff. I think it's kind of late for that.
I thought there was a comment in that article about that the microplastics were blocking blood flow and contributing to erectile dysfunction.
Yes, that is one of the things that they theorize.
Yeah. So, yeah, my follow-up comment to that would be that we all remember, well, most of us in this group session remember when plastics came of age. It was in our lifetime with Tupperware. Now you go to the grocery and all your produce is wrapped in plastic bags. All your food containers are plastics. Your clothes that you when we got wrinkle free, that was polyester. That was blending synthetic plastics with your natural fabrics. We're in a plastic age that our grandparents didn't live in, and it may make the difference between Viagra and Cialis sales today and conditions where Abraham was able to get Sarah pregnant at a very advanced age. Uh, it's the plastics are killing us.
Yeah, and may have little or nothing to do with erectile dysfunction, but may be even more frightening in that it's a manifestation of how microplastics is everywhere and in everything. And we're kind of late in getting to the solution because it's now everywhere in the world, in the oceans, wherever you are, you got plastics.
Yeah. Uh, Even our automobile tires, if it was just plain rubber, that would be great, natural substance. But all your tires now are synthetic rubbers, and so you get higher mileage from the tires by using rubber and plastics. And they're saying that tire dust is highly carcinogen. Of course, you park your car in your garage, and you fill up your garage with tire dust. That's toxic. And they suggest that you probably sweep out your garage every couple of days, but wear a mask when you do it.
Yeah, well, the comment in the article that one bottle of water contains 240,000 plastic particles kind of identifies the fact that it's much too late. And, the horse is already out of the barn. We're already consumed by plastics without having any idea. Before we know it, it's done. Uh,
This article makes me remember back when we used to get milk delivered, and there was a milk box on the porch, and they would deliver the glass containers of milk. That was the that was the good old days.
I
I
remember
wonder if
those
we
days.
I wonder if we can get back there.
Yeah, everything was in glass then. We thought, what a wonderful solution this plastic is.
Yeah. Well,
Wow.
plastic is cheap and glass is expensive. So
Yeah.
yeah, if you start packaging everything, okay, uh, you can store foodstuffs in plastic containers a lot longer than you can in paper. Remember when we used to go to the butcher shop? Everything was on paper where
Yeah.
you got your meat. But
Yeah.
now you're saving money for convenience, except for the money is going to healthcare.
Wow. Life is funny. Yeah. Yeah. Every time we make progress, we find that there's another side of the story.
You're right, but the reality today is if they delivered the glass bottle of milk on your porch, somebody would take it.
It's true. Yeah. My reality here at home, my husband loves his water, so he drinks his Deer Park from the bottle. And after hearing so much about plastics, I said, okay, I'm just going to stop buying and use water from the faucet. But I had to stop and think about it. I still put it in a plastic container. It's the drinking container, So what am I doing? It's the
Well,
same thing.
yeah, that's my point is that we're too much, too little, too late. It's kind of late now, but anyway.
I'm gonna take my glasses off the shelf and put them down so we can use glass. Because all my glasses are up on the shelf, and I'm gonna take them down.
Any other comments? Otherwise, we'll go to a subject that is much different. Now, this is an article about the gold standard for chronic pain and trying to demonstrate that new psychotherapeutic single course treatment with emotional awareness expression was more helpful than anything else in terms of relieving pain, so that we should go to our psychologists for a reduction of pain. And there's many studies that demonstrate that pain can be modified by many things, including pain medicine, but that psychological overtones are in pain as well. And so they are proposing that this is the best treatment for chronic pain. I guess the condition that fibromyalgia is one of the conditions that we've had much difficulty in treating, for which this may be one of the ways to treat it. As far as I know, there's really been not very many successful ways to treat fibromyalgia, but I'm still trying. You know, we sometimes don't realize how blessed we are to not have, to have a sound mind and be pain free is a great blessing if you have it. So many people suffer from not having a sound mind and not being free from pain.
John, can you go back to the title of the article? Dr. Callender, my question is, this gold standard, is this therapy without medicine? Is that what this is?
What is your question?
Is this therapy without medicine?
Yeah, that's it. Yes. It's emotional awareness, psychological treatment without
So
medicine.
is that with a doctor, or is that exercise, or what?
This is with psychotherapy.
Psychotherapist.
Yeah.
And so exercise seems like it would play a role.
No, this exercise, this is separate from exercise. So it's interesting that this is an article. Now remember, this is an article that is alleging that this should now become the gold standard. Whether and they have randomized studies that suggest that this may be the case, but this is just one article on the subject, and they suggesting that this is the way you treat it.
Yeah, I thought
One
it
of
was
the
interesting when you were saying that fibromyalgia was, related to this. Is a condition where psychological intervention could help with fibromyalgia. And it says one of the causes of fibromyalgia is prolonged psychological stress that triggers hypersensitivity and hyperactivity of the central nervous system that could cause a chronic pain. So, I've known some people with fibromyalgia, and it was treated, but, as far as like the root cause from a medical standpoint, it wasn't diagnosed. And just thinking about the people that I know with fibromyalgia, I could see the prolonged psychological stress that probably was a factor that needed to be treated.
Any other comments?
pain, and especially chronic pain, has so much to do with value, both between the physician and the patient and themselves. So we know the bias that has been around it's the underground component to our disproportionate amount of maternal mortality. And in sickle cell disease, the evaluation of the patient has always been devaluing the pain. So for people who have been disproportionately biased by this, getting into using psychological mechanisms for addressing the pain must have an underlying degree of value of the patient. And,
Well,
and to make that a little bit clearer, go ahead, to make that a little clearer, we so often, go ahead.
No, I'm just going to say sickle cell. You pointed out sickle cell disease and the pain associated with it is so much so that people who undervalue it and want to give them psychotherapy are confusing something that has a real legitimate cause for confusing that with something that has a psychological basis, whereas sickle cell pain is not psychological. It's real and it's caused by lack of blood getting to parts. And so, but as you pointed out, one of the situations that sickle cell patients have is that people don't want to give them pain medicine. And
absolutely.
Say again, Lucy.
I was just saying, absolutely. I was agreeing with you
because
they're, yeah, especially if they're teenagers and they're Black.
Right.
And likewise, if you're a pregnant woman and you're complaining about something and the medical staff gives you no attention, which, because, you know, this is a hysterical Black woman, hysterical Hispanic woman, and just leave it there. I got to do something else. And that's why we die. So the issue of pain and psychology is key. But it also has to be a dyad too. And I don't even want to say dyad. It has to be a respect of the system. Now, you said sickle cell. We should know that as medical professionals. But I have been there. I have had colleagues say, oh, they don't need that. Because of the bias they had, because of the color of their skin, and because of all the myths they had about them. So when we bring in psychology, we also have to bring in psychology about the racism associated with the medical system.
You're absolutely right. And of course, the fact that the white people thought that we didn't have pain as much as Black people fits into that absurdity. So your point is well taken. It's amazing that they would actually believe that we don't have pain like any other human being because we have Black skin, which is preposterous, but that's what they actually had in the medical literature. And some people actually believe that nonsense.
Carol, are you on the line? I wanted you to speak a little bit about your comments about Black women and pain around pregnancy and others. You have comments about that.
Um, no, except for when I was pregnant the first time and I wanted to have it natural, and the doctor fussed at me. He said they did all this for women, and especially Black women at Freeman's Hospital. They began to notice that Black women experience the same pain as white women, and that there were medications now where they didn't have to suffer for childbirth, and they could take medication, epidurals, and etc.
Yeah, but in general, you're saying that the medical industry thinks that women, Black women, don't have any pain.
No, we're talking about historically, because we know better than that now. But I'm just saying that early on, let's say 30 years ago, they actually had in the literature that Black people suffer pain less than white people, which is absurd.
Perhaps they were going all the way back to slavery times. They didn't realize that we were in pain, you know, but because we took it. We had to take it. So I guess they figured
What officer you talking about?
we didn't have the pain, but
Oh,
pain
you
was
talking
there,
about
but we just learned how to, our
the marriage
ancestors just
hospital?
learned how to take the pain.
Yeah,
Okay, I
They
was
didn't
just
have a
calling something
choice.
the name of the medicine.
Yeah.
I think that's an interesting observation, and it may be what they wanted to think, because we did exactly what you said. We enjoyed it because we had to, not because we liked it, but we had no other choice.
Yes. And maybe that's why I had 3 natural childbirths. I guess I'm thinking. I didn't. I thought that was. I don't know. I never liked medicine, so if I could endure it without the medicine, I did, and so that's what I did, and still do actually.
Any other comment about this article? If not, let's go to the next one. This is an interesting problem. Post-traumatic stress disorder is something that it's been since the wars. So many. What do they say about every 4 minutes a veteran is committing suicide because of post-traumatic stress disorder, and they have a new drug that purports to reduce post-traumatic stress disorder. And its first review was to deny this drug. There's no drug now that is effective at treating post-traumatic stress disorder. And so there's a lot of controversy as they plan to review it again. They turned it down first, and so it's a lot of controversy as they prepare to review it again, because it would make a big difference if we could really effectively treat post-traumatic stress disorder. It's so prevalent period. But because we have so many stresses. But if we were to find a drug that would help with this disease, it would be helpful. So the controversy is about whether or not the studies are sufficient to indicate that this drug is worthwhile. And so the first run at it, it was turned down, and they're going to review it again to see it. But I think it's important to recognize that PTSD is very common in our veterans and in other Americans, and we certainly need to find the medication that works for it. Any of you I have experience with people who have PTSD, post-traumatic stress disorder. And of course, you might argue that all of us blacks have it because we certainly are stressed. But anyway,
My,
open for any discussion you have.
my father's brother was in D-Day, where they stormed the beach in France.
Oh, really?
Yeah, he had it really, really, really bad, up until his death from World War II up all the way till he was in his 80s. And he went to the VA and they had all kind of different therapies, but no I'm not sure about the drug therapy, but my other comment about that is that if this is the same drug, this used to be on the market. It was a psychedelic sold with at the same time as LSD, psilocybin, mescaline, those psychedelic drugs. So part of the issue here is that it would get out and be abused on the open market, uh, you know, and then lace, of course, lace with fentanyl and cause a lot of deaths. So um, that's something they have to really be aware of. That this was, as far as I know, yeah, it was called ecstasy back in the day. Um, it was a drug of abuse.
But it was never studied, so it was never formally studied. That's why it was a problem. So now they are formally studying it, and so the question is, if in point of fact 82% of people who take it find it effective, then it may be approved. But it's going to be interesting to see because, as you mentioned, successful treatment of PTSD still remains an issue.
And it can't just be pharmaceuticals. That's a significant issue. You have to have the mental health services around the use of pharmaceuticals moving forward. And for children, adverse childhood events, the things that we are seeing turn out now to be a form of PTSD, recurrent violence. And, as you pointed out, being Black.
That's quite a stress. Well, it's going to be interesting to see what they finally decide. But I think your point of combining the treatments with the psychotherapeutic, I'm sorry, psychological approach, which brings to mind the fact that something that I think Carol brought up many times, that our Black kids are associated with so much gun violence that they may or may not be appreciated that they have PTSD from that source, and that is affecting them the rest of their lives. So they need a lot of the therapy along with the medication to get them well. But for many of them,
wouldn't it be interesting if we didn't have to treat it, but we address the reason why they have all these repeated traumas?
well, you mean why are we shooting each other? Is that what you mean?
Why are we shooting each other? Why are we greedy so that we have severe poverty? Why is it that we want to erase history? Why is it that I mean, we're a
Yeah, well, that's going
so
to the
let's find a
crux
drug.
of the matter. Going to the crux of the matter, which is rarely ever addressed.
Yeah, that is so true. I think that it's important for us to remember that this problem is mostly caused by a traumatic incident that happened in a person's life. So then that, as an example, you're a student at the bus stop and another student gets shot dead. And you witnessed that because you're right next to the student that got shot dead. That is a traumatic incident. And post, of course, means after the incident has happened. So you have to focus on a traumatic incident that happened in a person's life that lasts a lifetime. And that's what you have to treat. And I don't
Yeah, and that's what Carol has talked about for quite a while now. The fact that our kids in school are subject to this all the time, but the therapy for it is wanting. Lucy, you might have some comments about that, but Carol has mentioned this many times.
And so you have to treat the person because of the incident.
Right, but we're not doing that for the most part. We're not doing that in schools. And
I'm talking about in general, there's no medicine, there's no psychotherapy, I mean, there is psychotherapy.
yeah, there should be. Yeah,
But-
but we're not doing it. We're not doing it. That's the problem that I think Carol talked about on many occasions, that in the schools, they may have a short period of time that they address it, but don't really recognize that this is a lifetime disability in many ways. Any comments on that?
It's like the statement, kids coming in for disciplinary action in schools and things, and you say, what's wrong with you? Instead of what happened to you. It's shifting the behaviors that we're seeing. We don't, and when I say we, I'm saying without the sensitivity that there has been traumatic events that have occurred before the child gets to school.
That's right. Yeah.
I know I took my through, many of them were so, they were international graduates and they had no concept of why kids were truant, because school was, public education in the United States. And so they thought that not going to school, it was culturally unacceptable to them. But they needed to see the drug deals, the filth, and everything that these children had to walk through to get to the gang violence, everything that they had to walk through to get to school. And that truancy now is a major issue. Kids are afraid to go. And in the district, one of the things that they put in place for it, unfortunately, is to have them now interface with the criminal justice system. That scars us for life. And we know better.
Elizabeth, you had a comment?
Yes, again, good morning, everyone. Good morning, Dr. Callender. I totally agree. I'm thankful for the time that one of my desires was, before I retired, was to teach. And I really enjoyed teaching. And because I came out of healthcare, I came back into teaching with a holistic approach. Because in ambulatory healthcare center, it's an umbrella that has all your services right there in one place for the patient. So with that experience, I brought back into the fact that a child needs the holistic approach when it comes to teaching. And so, but when they switched, that freedom wasn't allowed to cover the child holistic, and they went to the evaluation of test evaluation, then it sort of reduced, not eliminated, reduced the time I had to devote to that child holistic, because you have to wrap it up. You have to cover the body, mind, and soul. You have to cover those three components. Okay, so you can't teach when a child is so traumatized that he can't focus on what you're saying. And so I'm thankful that I did have that time, because the test scores scored high when I had kids at that. Not that they didn't score later on, but I had a comparison between the elementary students I taught and the junior high students I taught, which was more traumatized than the elementary students. And, I just kept praying and praying for a solution. And I came up with a solution, and I was given a solution. And so that holistic approach has to be utilized to really cover that child in an umbrella setting for success.
Thank you for your comment. Any other comments? If not, let's go to the next article.
We need to clone you.
This is an article about the fact that rather than, because this came up in a conversation about a month ago where we talked about doctors giving vitamin D without getting blood tests. And this article points out that for these four categories, you don't need a screen. They should just go ahead and treat them. And you see adults older than 75, patients with prediabetes, pregnant women, and the other categories. And remember, Darryl had a comment about whether or not, and there was much discussion among experts about whether or not vitamin D was a treatment of choice for these conditions. But it's clear that certainly if you have vitamin D deficiency, then vitamin D is necessary. But for some doctors, for people over 75, they empirically give them vitamin D/C. And this article is suggesting that it should only be done for those people who fit into those four categories. Any comment about this? Because I remember there was a lot of discussion about some doctors who just indiscriminately, it appeared, would give you vitamin D when you're over 70 years of age. And actually, there was data that demonstrated that many of the Black patients had vitamin D deficiencies, particularly the patients who had renal disease. Any comments about this? I remember there was a discussion about this before.
My doctor definitely gave me vitamin D once I got older. She just said, you need to start taking vitamin D.
And apparently this article would agree with that practice.
Mm-hmm.
Okay, well, let's go to the next one. Oh, I think John Buchanan had mentioned the fact that there was a new pneumococcal vaccine that was more effective and more efficient against more serotypes than previously. And so the question is, if you had the old pneumococcal vaccine, should you now get this new, more protective pneumococcal vaccine? And it seems like that the answer would be positive, but the real answer would be to go to your doctor and discuss it with him and see what he wants to do about it. And also how old you are and when you got your vaccine. Because there's additional pneumonia protective aspects that, and then of course the $287 per dose is something that you have to address as well.
Dr. Callender, I'm not sure if this is the one that I saw advertised. So the one I saw,
it's a Pfizer. It's a Pfizer.
This says Pfizer?
Yeah.
Oh, okay. Is that, I was looking for that. I didn't see Pfizer on there.
I think at the bottom, this is
The last paragraph.
But that's a competition. So there are other.
yeah.
There are others.
Right.
Yeah. The one I saw on the TV was Pfizer.
Yeah, I see.
Yeah, Cap Vaxiv, Cap Vaxiv, Pfizer, and Prevnar. You know, all these companies in competition with each other.
Yeah.
If we had the old pneumonia shot within the last year, should we get the new one right away?
Well, that's the question that I think depends upon your age. For example, if you were 80 years old like me, that's something to consider. And I guess you'd have to talk to your doctor about that, what his advice would be. I think if you're younger and in your 60s, you might wait a while. If you're over 80, you might strongly consider it.
This is one that we take yearly anyway, so.
Not yearly, but periodically.
I thought we took the pneumonia one yearly. You don't?
No, I don't think so. That's not my recollection, because he took it over 2 years, I think. But I could be wrong. But my recollection was that you got one dose, got another dose, and was protected. But I don't remember that it was annual.
I think
The flu is annually.
yeah.
The flu is annually, and I thought it was much longer than 2 years. I thought it was closer to 5 years. But I could be wrong on that, but I know it's not
I'll look it up.
pneumococcal.
I'll look it up, and next week we'll discuss that again. It's a good question, good topic. So we'll come back next week with answers to this question.
Okay.
Because that what Darryl asked is a very good question. Is should you, now that you got a new vaccine that covers more pneumonias, should you then take this? And so I'll investigate that and get back to you next week.
Just looked at Google, and it doesn't recommend the pneumonia shot every year. But it does say that 1 to 3 doses of the pneumococcal vaccine will likely last the rest of your life.
Yeah, that's my expectation. Yeah, once you get it, yeah. Okay, let's go to the next one then. It's interesting. Ulcerative colitis is a disease that some people have that can be lethal and can be associated with a lot of intestinal discomfort. And many people wind up requiring being treated with steroids and antibiotics to reduce the symptomatology and eliminate it. But some people, in spite of the treatment, have to have colectomies, where they take out the whole colon, so that trying to have this controlled is very important, because it is something that many people don't have, but they have new medications that are more effective than ever before. This talks about a new drug that is now approved. This is among, and it's amazing how many monoclonal antibodies they have for different products, and now they have one ulcerative colitis. I don't know if any of you have suffered from colitis, but it is a disease that's associated with abdominal cramps and pains and diarrhea and other things like that. So,
And Dr. Callender, I've had a couple of my friends who've had that colitis and Crohn's, and they were, I tell you, for years were miserable.
yeah,
Miserable. It's a horrible condition to have. But what's weird to me is that Skyrizi has been on the advertisements for almost a year, I think. Even if there was a singer, I forget her name, very popular singer who's in the ad, who is used Skyrizi and treated the Crohn's disease as a result. So, it's I don't understand how they can
well,
they can
listen, here's what
they
it
can
is.
advertise without being approved by FDA.
Well, here's what it is. The drug is approved for another condition. So once it's approved for one condition, it can be used for another condition without requiring additional approval. And so that's why it was approved for psoriasis. So once it's FDA approved for psoriasis, you find another indication, you can still use the drug. And that's why it appears to be problematic, but it isn't. There's a number of situations where one drug was originally used for one disease, but is found to be effective for more than one disease. And so that drug is already approved, but it's not approved for that condition, but doctors can use it if they want to.
Question, Dr. Callender. Sometimes a drug, well, let's use Skyrizi as an example. You get a drug for one thing, and the side effect of that drug helps with something else. So now you can prescribe that drug for the something else.
Right. Yeah, that's exactly right. Okay, let's go to the next one. It's an interesting issue that people with dementia, as you know, sometimes have difficulty swallowing things. And for that, they used to recognize, or they used to advise thickened liquids that would reduce the risk of aspiration. And what they've identified after research is that this doesn't help, it doesn't protect people from aspiration. And so they just say that we need to stop doing that. This is a practice that has been going on for some time. And after advising and looking at it, that older people who can't swallow well, that these so-called thin liquid diets really aren't effective. What does that mean? It means that people were aspirating anyway, even with the so-called thinner liquids. So, and you know, it's interesting when people get so old that they can no longer swallow. You wonder, is gastrostomy the best treatment for it, or not? Any thoughts?
And my mom had that at the very end. But I just had a question, a definition of dysphagia.
Inability to swallow.
That's it. Okay. Yeah, she had that at the very end.
Question is prolonging the life with gastrostomy worth it? What are your thoughts?
I see Elizabeth's hand.
What'd you say?
Yeah.
I said I was going to ask a question, but I see Elizabeth's hand. So
Thank you, Betty. Yes, quickly, Dr. Callender, the book that Kara mentioned that I gave to her at one of our meetings, when my mother was diagnosed with dementia, I read everything, took classes, everything, because I wanted to be prepared. But when she was in the rehab, my sister and I, she wouldn't eat for the health workers. And so, you know, we would feed her. We decided that we would feed her because she wasn't eating at all. And so when we would feed her, we would massage her throat, and we would go through the motion of that, you know, because they look at us to see what we're doing and they imitate us. And so we would feed her, and we would tell her things like, open your mouth. Okay, now it's time to swallow. And we would touch her throat so she couldn't swallow. And so we were thankful that we were able to get her to start eating and swallowing.
Okay. But when she get to the point where she couldn't swallow, would a gastrostomy feeding be advised from your perspective?
Dr. Callender, I would do anything to prolong my mother's life. So whatever medical resources and techniques there are, I would utilize them.
Any other thoughts?
What I was going to say as far as the liquid is concerned, my mom had, well, she had dementia too, but her swallowing issue, I'm not really sure where it came from. It might have just been her own fear, but she wouldn't lay down in the bed. She was afraid to lie down. She slept in a chair all the time for, I know, a year, maybe probably closer to 2 years. And she lived on Insure for I know a year and a half. That's all. Besides ice cream, which she loved dearly. Ice cream and Insure. She lived on it. And so she died suddenly. So I don't know whether, you know, the swallowing didn't have anything to do with her death, I don't think, but she lived on it. So
also, Dr. Callender, we had to go through transition with the nutrition on how her food was prepared. You know, they started off with liquids, and then they kept increasing, and they would test the solids to the point that they get to the solid. But when she was discharged, she never got to solid. we got to what it was puree, the food. We got to the point that was puree. We went from liquid to puree. So that's what my sister's doing for her.
Any other thoughts or comments?
My dad had that problem with the throat muscles. And I mean, he was fully conscious of how to eat and everything. And it's just age related that your musculature deteriorates as you get elderly. And that's, in your 30s, just another muscle. So he used to eat applesauce.
I see. It was easy for him to swallow that, huh?
Yeah, it could just slide down because, his throat muscles were subject to general atrophy that we all get when you get. Of course, now he lived to be 4 days from 102 years old. And so his muscles, began to not work like they would normally if he's young.
I do know that the patient, one of our church members that I was taking care of when he was in an assisted living place, toward the end, their definition of it was he just forgot to eat. He just forgot how to eat. And so that was eventually his demise because he just forgot to swallow. He wouldn't swallow. So
did they want to do
what they did.
did they want to do a gastrostomy on him to feed him?
Well, his family was in charge of that, so I'm not sure, but I don't know whether it was even offered, to be honest. But that was what they said, that he just forgot to eat. He just put the food in his mouth, but he wouldn't swallow. And Charles's mother was the same. She would hold food in her mouth for hours.
Really?
Couldn't swallow.
Okay.
Dr.
other
Callender, I have a question. People in hospice, do they recognize, I'm hearing everybody, and I've seen it happen with my mother and father-in-law, they say thick, thin. Is this just one of the processes of deterioration of going to death, and they blame the patient for not wanting to eat and etc. But it sounds like this is just one of the processes, and we're trying to prevent the inevitable of death. Whether we're feeding our loved ones, we find out if their throats are closing up and etc. Medical science, have they found out or figured out any way to, we just seen an article on thick and thin, but it just appears that this is all the process that some of us have to go through before death.
Yeah.
So it's just another way of prolonging death, or what?
Well, it's interesting because my thoughts on the matter are that gastrostomy, which is feeding you through your stomach when you no longer can swallow, is prolonging the inevitable. The question is that something that you would want to be done to you when you get to that stage, or would you rather just proceed to go to transition to death? And I think it's something that every person should decide for themselves long before this occurs, and that is when you get to the point where you can't eat or don't want to eat, do you want to have your life prolonged by gastrostomy and have them feeding you, or would you rather just go when it's your time? That's a question that every individual should try to answer for themselves before they get to the point, because otherwise your children will answer it for you.
Yes, you have a bunch of children, doting senior citizens' children, cramming food in your mouth. You have no appetite. You're holding it all day long. You're having someone put something in your stomach to make you want to eat. Your mind, your body, you're shutting down, but everybody is cutting on you, forcing things down your throat, and etc. It doesn't sound like it's much fun your last days here on earth.
I agree with you.
But we're all trying to do the best we can with our parents, and we're blaming them. You lost your appetite. Come on, you got to get your appetite. But there's nothing you basically can do. This is just a natural process and an inevitable, and we don't want to see it happen. So if we do this, we're prolonging it. But are you making people suffer? I know one thing my mother told me toward the end of the life, well, besides that getting old was a hamburger, or it was the pits. She said, since she was she knew that she was passing. She said, shoot, I'd rather been eating what I would enjoy eating instead of trying to stop myself from eating things that brought me joy to life. And now that we're older, I see that. How do you personally feel? Now, all of us, we're in control, but how do you think you would feel when you have your children hovering over you, forcing stuff in your mouth, punching holes in your stomach after they put a sedation, forcing you to eat? Your mind is shut down. You no longer want to eat. You're having a hard time gagging and struggling. Because I remember my father-in-law, the grandchildren and everybody around him setting food before him, whether it was thickened liquid or soft liquid, whatever the hospital prescribed to get him to eat. And I've heard some of you saying that your parents held it in their mouth all day long or something because they couldn't swallow. Would you want that experience, or somebody touching all over you trying to make your throat take the substance in?
That's a good question, and that's something that an individual decision should be made while you're able to do so, because that's an individual. I think every one of us should make a decision about that for themselves while they're well and healthy. I think that for me, I would not want a gastrostomy or any of those things. If I decide not to eat, then it's time to go. That's my personal decision. But
I have a personal story about not necessarily not wanting to eat, not being able to eat like I wanted to. I had some sort of, I thought it was a blockage or whatever, but when I went and got tested, it was something, the connection from the esophagus to my stomach was narrow. And so I had to have it opened up. And okay, I don't have dementia. I was suffering. I went and got it fixed.
yeah, that's a medical condition.
Yeah, that's what I'm saying. I was able to determine for myself
what
I wanted to do. But if that were to happen maybe 10 years from now or 5 years from now, if and when maybe I got dementia, I don't know that I would want to go through, I think I'm a Dr. Callender person. I would rather just go normally. Whatever happens, happens.
Yeah, well, it's a good topic for a discussion, and thank you for obliging us and giving us your thoughts. Okay, well, time is up. I guess it's time for us to go.